Dr. Asmita Potdar. Dr. Asmita is a senior obstetrician, gynecologist, and an IVF consultant at La Moms and Miracles Clinic in Pune. She is practicing since the last 15 years. She has done her master's in IVF and reproductive medicine from London. She has conducted more than 2,000 deliveries. She has achieved more than 150 pregnancies through IVF, and she's an expert in high risk pregnancies, IVF, and laparoscopy. Welcome to the session, doctor.
Thank you, Shweta, for such a kind introduction. It's my pleasure to be here, and I think besides the routine gynec, it is also important for us to educate people on menstrual hygiene and about safety in using the correct pads, or like we have today a new thing, underwear, which will prevent environmental hazards and also be very safe for the women
True.
and younger girls especially. So
Yes,
it's a
very.
pleasure to be on a interactive session to talk on something like this.
Yes, certainly. Doctor, to start with today's topic, could you please share what are some of the things that women can expect while getting their first period after giving birth?
Right. After immediately after delivery, there will be bleeding for up to 6 weeks. Now, up to 6 weeks means it does not mean that they will bleed continuously for 6 weeks. It is heavy or like a normal period for the first 5 to 10 days. After 10 days, the bleeding slowly reduces, and it can then settle down to something like a yellowish discoloration or just a spotting after 2 weeks of delivery. Then, from 2 to 6 weeks of delivery, a woman can experience a little bit of spotting or a bleeding, or even just white discharge or yellowish discharge, and this is called as a lochia. It is not actually a menstrual blood, it is just discharge from the vagina, which happens very often after delivery or after cesarean. And this is very normal. So, up to 6 weeks, if a woman is having periods or if a woman is bleeding after delivery, it is considered absolutely normal. Now, when one should be worried about is if one is experiencing very heavy bleeding. It can happen even immediately after delivery, or it can happen later. Later means after she goes home, say about 2 weeks later, and it is called as not a bleeding or not menstruation, but it is called as secondary postpartum hemorrhage. And that is a very important thing to know, because that is not normal, and in that case you have to reach to the hospital immediately, because you are at home and you are taking care of the newborn. Sometimes women tend to neglect this type of heavy bleeding, and it leads to severe anemia and other health problems to the woman. So if you are bleeding like more than changing more than 8 to 10 pads in a day after 2 weeks of delivery, then that is the time when you have to come to the hospital immediately.
Okay, okay. So this is immediately after giving birth. And then
Right.
there are a few months after that for which the woman does not get her regular menstrual cycle.
Right. So,
After a few
what
months, she will
happens?
get it.
So, what happens is after 6 weeks of delivery, the woman can get periods anytime. Some women get periods as early as second month of delivery. Some women may not get periods up to 1 year. Now, it largely depends upon whether she is breastfeeding the child and whether she is exclusively breastfeeding the child. If she's exclusively breastfeeding the child, that is, she's feeding the child every 2 hours, then the chances that she will get her period immediately are less, and probably will not get period up to about 1 year after delivery. But there are a lot of women who get periods, regular periods, from third month of delivery, even if they are breastfeeding their babies exclusively. So it does not mean, a lot of time women come to me saying that, doctor, I got my periods, and I'm still breastfeeding. So is it that my milk is inferior in quality, or is it that my baby is not going to get enough nutrition, or his or her tummy is not going to be filled because with my milk? And I explained them that that is not the thing, but your hypothalamo pituitary ovarian axis has started functioning normally, and it can happen that you will get your periods immediately after 2 months of delivery. In large majority though, if you are breastfeeding, you will not get period up to 1 year. Also in this 1 year there will be a lot of irregularity, and that is absolutely normal. Some women will get periods every alternate month, some women will get periods every 4 months, and this is accepted till the time you are sure that you are not pregnant again. That is
Okay.
very important, because you can get pregnant after 3 months of delivery. Anytime you can get pregnant, the ovulation starts at that time.
Okay, right. Are there any problems that occur very commonly after the cycle is regularized?
Uh, so see, for the first year, if there are any problems like irregular bleeding, we really don't treat it. We tell the new mother that this is expected and this is normal. What happens is, a lot of times, even if the woman is getting regular periods and still the baby is small, like if the woman is getting periods in her third month or fourth month of delivery, and if the baby is small, she has to run around with the baby, she has to feed the baby, so there is invariably a little weakness which creeps in, or a little lethargy which creeps in. And a lot of time, even after repeatedly reminding women to take their iron and calciums, they forget taking iron calcium, and that along with the periods and taking care of newborn, sometimes it becomes very hectic to the woman. Also mood swings which are there any which ways during menstruation, and something called as PMS, we all know about it. It is exaggerated in post delivery phase. So after delivery up to about 1 year, the PMS is exaggerated, and women may become very irritated, or they may get very depressed on small issues. So we have to make sure that their nutrition is well maintained, and we have to make sure that they get a lot of tender love care, because after delivery a lot of focus shifts from the mother to the child, and sometimes this leads to such type of problems which get exaggerated during periods or just before periods.
Right. So, is there any particular diet that women can follow, or are there any practices that they can follow so that they could minimize all these uh, symptoms that you just
Yes.
mentioned?
Yes. So post delivery, there are number of different rituals or traditions according to which women are given food. Now there are certain traditions which are good, and certain traditions which are really harmful for the young mothers. Now what are the traditions which are good? So traditions which are good are that giving water which has got a few spices in it, like for reducing bloating, and having warm water after delivery. So these are good practices, no problem in that. But there are certain practices in which the woman is told to have only chapati with a very diluted dal, and no sabji is given, and fruits are not given. And I wonder from where these traditions have come, because green leafy vegetables are very important post delivery. Also it is important to take adequate amount of proteins after delivery, because only after delivery it is the time when women need more nutrition, women need more calories. During pregnancy women do not need extra calories to that extent, but during after delivery, during breastfeeding, they need about 500 kcal more every day. So green leafy vegetables are very important. Every day one green leafy vegetable is a must in the diet. uh, Traditionally also methi is given, and that is very good. Milk consumption is good, but it can lead to little gases to the baby, so it depends upon whether your baby has got issues with colic, then you can avoid it. But otherwise dairy consumption is also important, because calcium requirement is to be fulfilled. It is very important to drink more water, because post delivery, when you are lactating the baby, because of milk secretion, there is increased demand of water, because like normally when a woman is not breastfeeding, the only water loss is through urine and sweat. But here she is producing milk, so that additional 1 to 1.5 liters which she is producing milk has to be replenished, so water intake has to be more. This otherwise leads to a lot of problems like constipation if the water intake is not good enough. Also this is exaggerated during periods, so constipation along with period can be very painful to women. And that is important that during periods at least they increase their water intake. Also iron rich foods like gond ke laddu, groundnut jaggery laddu, these are very very good. And if you're not diabetic, definitely have at least one or two of dry fruit laddus every day. Those are very good. So these are certain foods which definitely should be taken. And don't make women eat very bland food. It's okay, they can also have a little spicy food or little tasty food even after delivery. Because otherwise, traditionally, yes, I agree that a little less spicy should be given. But then sometimes women don't like it, and then they don't eat. And when they don't eat, then they have such nutritional deficiency. So there has to be a balance between what is best for the baby, and it shouldn't really affect the health of mother. So a balanced diet and something which the mother likes is important.
Right. Okay. And what are some of the exercises or physical activities you would suggest for a new mother, and how soon can they start these activities?
Even after cesarean, a little bit of exercises started as early as the third day of delivery. And there are certain exercises typically in hospital, a physiotherapist probably will tell them, but upper body exercises are started as soon as the mother is able to get up from the bed. I'm talking about cesarean. In normal delivery, though, you come out of the delivery room walking, so that is a different thing. But even in cesarean, on day 3, you can start with upper body exercises. Now, in normal delivery, also, we say that avoid a lot of lower body exercises for at least 6 weeks. And for cesarean, avoid lower body exercises for at least 3 months, especially abdominal crunches or planks and heavy exercises, which can lead to direct pressure on the tummy. The uterus is still a pelvic organ. It is still not a pelvic organ. I mean, the uterus is not going back to its normal size immediately after delivery. It is going to go back to its normal size after 6 weeks after delivery. So for the first 6 weeks, go slow. You can do home exercises, you can go for a walk, you can do normal stretches of upper body. But heavy weightlifting or cycling or heavy treadmill is not really recommended. A walk is the best form of exercise during and after pregnancy, also as early as third day.
Okay. Okay. So you recommend starting physical activity that soon.
Yes, yes.
Okay.
If the baby permits, but
Yeah.
don't stress on that. If the baby is not giving you enough time and the baby is crying and you need to feed the baby, then please don't stress on physical activity. Like I said, even a 10 to 15 minutes of walk during baby's nap time and in between your working schedule. Working means, I know you, most of women will be on maternity leave, but working, I mean, you have to even have your own bath, your food, your babies, everything, diapers and all changed and everything ready for the baby. So in between that, even a 15 to 20 minutes walk is a good, and probably that is the only thing which women will be able to manage at that stage.
Right. So for some women, they go through a long phase of not getting any periods at all. So how long can a woman wait without worrying to get her first period after giving birth? And at what stage should she be consulting a doctor for not getting her period?
About 1 year, a woman can safely wait after delivery. After 1 year, also depends upon how much she is breastfeeding. But after 1 year, generally, kids start eating solid food, and that's why it is mostly nighttime feed. And then breastfeeding cannot be made a reason for not getting periods. And after 1 year, definitely you should see a doctor if you're not still getting your periods.
Right. Okay. So,
Also, I
uh,
wanted to say a few things about postpartum menstruation in women who have problems like fibroids or polyps or PCO and other things, because they will have a little different issues than women who do not have this. So, a woman with fibroids is at a higher risk of having heavy bleeding, especially in the first period after delivery or even immediately after delivery, because the fibroid is going to be causing a lot of pressure on the uterus. Right now, it was being compensated with the baby growing, but now the fibroid has become really big. During pregnancy, fibroids grow, and that is the reason post delivery, if a woman has fibroid, she may experience very very heavy bleeding, and she has to make sure that if that happens, she has to consult a doctor and take appropriate medications for that. On the other hand, a woman who has PCO and she has always had irregular periods may not get period even after 1 year of delivery, and that is the time when she needs to see the doctor.
Okay, okay. Doctor, nowadays there is a lot of discussion going on about the chemicals that the disposable sanitary napkins have. So, what do you
Correct.
think should be the perspective of a layman of looking at it? Also, as a doctor, what is your opinion on these chemical content in the napkins, and their effect on our health as well as on the environment?
Okay, so there have been a few studies in which they have seen that yes, there are chemicals in most of the sanitary pads which are used. Until now, we were just worried about the environmental effect. Of course, there is a lot of environmental effect. The sanitary pads do not get degraded and they are not biodegradable. They stay in the environment for a very, very long time, for more than hundreds of years. And that is why it is our responsibility as women to shift to biodegradable sanitary ware, may it be cups, may it be disposable, biodegradable pads, or disposable or reusable panties, or whatever. But in this, the most important thing which has come up recently is that these chemicals are also causing certain type of cancers in women, though there is not enough proof yet that the cancers are because of the chemicals in the pad, but there seems to be a little evidence about the same. So for both, for women's health, for their own health, and for the environment, it is better to shift to a biodegradable or a sustainable sanitary ware.
Right. So, just to inform all our viewers, in case you are bothered by disposable napkins and all the rashes that it causes, you could check out our period underwear. If you want to check it out, you can click on the link above and buy the underwear there. The USP of it is that it's comfortable, soft, rash free, washable, and reusable. So, it will eventually give you a stress free period, and stress free not just for you, but for the environment also. So do check it out to get some good discount in the link above given in the description. Doctor, there is one term that is used a lot nowadays called a sustainable menstruation. So could you please shed some light on that also?
Sustainable menstruation, you want, a sustainable menstrual wear? I mean,
Menstrual
sustainable
wear.
sanitary wear. Sanitary
Yes.
wear. Okay. So when we say sustainable sanitary wear, that basically means something which will have less carbon footprint, which will have less impact, negative impact on the environment. When we say that, it covers a wide range of sanitary wear, and there are a lot of innovations which are coming up. Frankly, I did not know about your period underwear till I was contacted by you, so that I think is quite impressive, that it's very convenient rather than using a menstrual cup. Now menstrual cup is something which is very famous, and I personally think it is one of the greatest inventions, but it is not really very comfortable to younger women, especially who are virgins. They find it very difficult to insert it, and then and the new generation is probably very very environment friendly. They are conscious about their choices, and when they come and ask us that what are the sustainable options, then till now we had only menstrual cups and a few brands who were coming up with biodegradable napkins. But biodegradable napkins still go into the waste. Now, when we are talking about a sustainable sanitary ware, I feel it is our responsibility to clean and reuse whatever it whenever it is possible. Now, why this? Because see, when we are throwing a sanitary pad in a dustbin, some rack picker is going to pick it up, and they are going to feel dirty about it. And we have to, as humans, we have to be responsible for our own cleanliness. And uh, if we feel bad, or if there are certain times when patients or younger girls ask me, but then it's so dirty to clean the sanitary ware and then reuse it. But just imagine how the rat picker will feel about it.
Very
So
true.
I think it is very important that we understand that it is something which was earlier there. only thing was that earlier it was not effective. That is why. So cloth pads have been used since ages, but then it was not effective. It used to not have enough soaking capacity, and that was the reason that there was problems. Otherwise, there are no problems in having a sustainable sanitary wear. So biodegradable pads, period underwears, menstrual cups, all these come under sustainable sanitary wear.
Thank you. Thank you for sharing that knowledge. I'm sure a lot of our viewers are going to have good nuggets of knowledge from this conversation today. I
Thank
think
you.
with that, we should move on to the viewers' questions now. The first
Sure.
question we have is, it's 19
Mhm.
months postpartum, but my periods are still not regular. I'm breastfeeding my baby only at night.
Okay, so like I said, if you're breastfeeding, a little irregularity is still accepted at 19 months, but you should be getting periods. It shouldn't be that you're not getting it at all. If you're getting every 2 months, that's fine. Till the time you're breastfeeding, we accept irregularity and we do not treat it. Of course, at the same time, when I say we accept irregularity, I'm assuming that the thyroid and other hormones are all normal, hemoglobin is normal, and you are fit and fine and healthy otherwise. And only that issue which seems to be there is the breastfeeding, and then we really don't give any treatment as such for that.
Okay. The next question we have is, it's been 5 months since my second delivery and my periods resumed after 2 months of my delivery. Does it really happen and does it affect breastfeeding? What can we do to maintain good milk supply regularly?
I actually covered this, but I'll cover it again because this is one of the commonest queries which come. Like I said, in most of the women, like 75 to 80% of women will not get their first period so early, especially if they are breastfeeding. But there are another 20 to 25% of women who will get their first menses as early as second or third month. That does not affect the milk supply. That does not affect the milk quality, and you can be rest assured that your milk is as good as any woman who is not getting periods. Also, to improve your baby's nutrition or to improve the milk quality, what you need to do is make sure that you are healthy, your parameters are good, because iron is only given from the milk to the baby, calcium is given from the milk to the baby. So if you are deficient in iron and calcium, your baby is going to be deficient in iron and calcium. So it is very, very important that you make sure that you are taking supplements when you are breastfeeding. I recommend calcium supplementation for a full 1 year after delivery, and iron supplement at least for 3 to 6 months after delivery. Also, your total calorie intake should be more, and these things are going to affect the quality of your milk and not periods. Just because you got period, that does not mean that your milk is of any inferior quality.
Great, great. Okay. There's another question that you've probably answered, but I think they have another point. What about PCOD? Can women continue to have PCOD even after delivery? And can this make periods irregular? So I think what they mean to ask is, does PCOD go away on its own and have any effects on the periods postpartum?
Okay, so to answer the question, the main thing is that PCO is something which can be controlled, but it largely depends upon if the lifestyle is corrected, if you are exercising regularly, if your weight is under control. So only because you were pregnant, that does not mean that the PCO will go away immediately. But when you are breastfeeding the child, the because we accept a little irregularity, that's why we do not treat it. But PCO will not go away just because you are pregnant. No, it doesn't happen.
The next question is, preconception, my cycle was of 28 days and now it's of 32 days. Also, I bled for only 3 to 4 days. I bleed for 3 to 4 days now. Previously, it was around 6 to 7 days. Is that normal?
Yes, it's absolutely normal. See, like it may not, it be maybe just coincidental that this happened after delivery, but there will be changes in menses at every stage of your life. So if you were having say 6 to 7 days of periods during your 30s, and you may change it to 3 to 4 days in your 35 or 40 years of age. That's perfectly normal. And there will be certain change in days, number of days after which you get your cycle. What is considered normal is between 21 to 35 days if you get your period. So this time you got in 25 days, next time you got in 28 days, that is also absolutely fine. Up to 35 days, it's fine. Beyond 35 days, it's called irregular.
Okay. The next question is, this is after my second delivery postpartum, 20 months. In recent months, I'm getting unusual pain in my stomach before my period and sometimes normal days too. What may be the reason?
So I would need a more history about it, whether there is any endometriosis, there is any ovarian cyst, because mild pain before period is normal, but it is something which is called as a congestive dysmenorrhea. That is, it happens before periods, and after periods, the pain disappears. That could be because of a lot of things, but one of the commonest things in that is endometriosis and fibroids. So a sonography would be worthwhile, and if the sonography is normal, then you can just neglect the pain if it is not unbearable. If it is unbearable, then of course we need to go in more details and do more investigations to see why it is such a severe pain.
Okay.
But this is not just because of delivery, it is not related to it.
Right. The next question is, I have a C-section. I have C-section for two deliveries, but then if I do any household chores, then I still feel a slight pain at the stitches. Is that normal or do I have to consult a doctor for that?
It shouldn't happen, like after two sections also, why should you have pain? Like, unless you have delivered a baby very recently, then it can pain for 6 to 8 months after delivery, a slight pain, a slight stretching effect, but otherwise it shouldn't pain. No.
Okay.
It can again mean to something like a scar endometriosis. If the pain is very severe, it can mean a disease which is called as scar endometriosis, in which the cesarean section scar needs to be uh, refreshed. That is, but anyway, it depends whether she has that diagnosis or not.
I'm just checking out some newer comments that we've received.
Sure.
Periods before delivery, I had no issues, but after delivery, lot of back pain, stomach pain as a working woman. Is it's tough to manage. Please give me some suggestions.
um Okay, so the most important suggestion here is you cannot pour from an empty jar. So you have to take care of yourself. You have to make sure that you get at least half an hour to 45 minutes every day for yourself. Back pain is the commonest thing which happens to women, and that is exclusively because we are not paying attention to our exercises. We are not strengthening our back. We are not taking enough calcium. So unless you do that, you are going to have pain. And then of course, if you are in pain, you cannot help your baby that much, you cannot do your work effectively. So take out half an hour for yourself. Don't feel guilty about uh, giving yourself time. Give the baby to someone else, hire a nanny, do whatever, but half an hour to 45 minutes, if you cannot give for yourself, it's just not worth it. Don't work, don't look after the baby for that half an hour to 45 minutes. You have to give it. Me time is important. And me time, not just, I'm not saying me time to watch Netflix or something like that, but me time to strengthen your body. This is the only thing which is going to be with you for entire life. Your body, it has to be strong.
True, very true.
I hope I have motivated her, because there are no shortcuts. There is
Yes,
no magic formula. So only thing which I can do is to motivate her to exercise. Everyone is busy. Everyone. See, I also understand that you may not be able to make it every day, but at least 3 to 4 days in a week, 45 minutes of back strengthening, and it should go. And calcium supplementation every day. There are no two ways about it.
true, very true. I'm sure they're going to have some motivation from this.
I
The
hope so.
next question is, I have severe white discharge in between two cycles.
Okay, so this is a important topic. So let's talk a little bit about it. Now, white discharge is of different types. If the white discharge is foul smelling, or if it has if it is causing itching to you, it is not normal. It is a abnormal white discharge, and in that case, you should see your doctor, because then it depends whether you have a bacterial infection, fungal infection, which we cannot comment on unless we actually examine the woman. But there is other type of white discharge which happens between periods, which is non-smelly, which is non-itchy, and it just makes the woman feel uncomfortable because she feels extremely wet. Now this is normal, because the white discharge which happens during mid cycle is to help in letting the sperms go in or go up the uterine cavity for normal fertilization. So God has made our bodies in such a way that the woman will have maximum watery or sticky transparent discharge mid cycle. But if it is happening throughout the cycle, that again means that there is some deficiencies, or there is stress, or there is physically she is not fit enough, like I say, weakness or some deficiencies, because of which this discharge can happen. But only during ovulation time, that is say mid cycle, 3 to 4 days, if you are having discharge, that is perfect. That means you are having a perfect ovulatory cycle, and don't do anything about it.
Great. So I think with that, we've reached to the end of the questions that we have so far. I'm sure the
Okay.
viewers are going to have more questions as they watch the replay as well. So please do mention all your queries within the comments, and we will send them to doctor and we will answer them. Our team will answer them for you in the comments. Oh, we have another question coming. Just a second.
Sure.
How to manage urine incontinence? Like if I'm feeling an urge to pee, when I go to pee, I can see some wetness on my panty. How to manage? And is this normal? I'm
So this is also another important thing which happens post delivery. Also, it happens to a lot of younger women also, who are a little on a overweight side. Now this happens because there is weakness of the pelvic floor muscles. The best thing you can start doing at a very early age is Kegels exercise. Now I will try to explain you what are Kegels exercises. So basically, when you have a urge to urinate, and you don't have a washroom, you are able to voluntarily control passing of urine. Now the muscles which you use at that time to voluntarily control the urine, you have to clench those muscles, hold them for 5 seconds, release them, again quench those muscles, hold and release. This is called as Kegels exercise, and this you can do up to 100 to 500 times in a day. It takes hardly 4 to 5 minutes for even doing that much. So incontinence is a problem which will happen if you do not have strong pelvic floor. Also, it will happen if you have a lot of belly fat, because it is going to keep pressing on your bladder, and it is going to leak a little drops of urine. Also, there are two different types of incontinence. One is stress incontinence, and second is urge incontinence. Now stress incontinence is when you get incontinence, that is, there is a little leaking of urine after coughing, or after sneezing, or after even a very heavy bout of laughter. And second type of incontinence is a urge incontinence, in which you are not able to control urine even up till the time you reach the washroom. And urge incontinence is generally in a little elderly age group, while stress incontinence can happen across age groups. It happens even in later life, but it can happen to a very young woman who, if she is on a overweight side. So only thing which we can do, and very effective, it is a very effective exercise, is Kegels exercise. Of course, if that doesn't control and the incontinence becomes too much, then there are medicines, or in worst case scenarios, there is surgical option also available. But if we start exercises in early, it is going to help, and then of course prevention is better than the cure.
true, true. Very true. The next question is periods migraine common after delivery periods? Too much of headache and vomiting session.
So period migraine is common post or pre-delivery. Also, a lot of women get period migraine. It is a very serious thing, and if you have migraines, it will be exaggerated during periods. Unfortunately, there is nothing much we can do. Otherwise, we have to give, if it is absolutely unbearable, and then we have to give hormonal treatment, because this is because of estrogens that the migraines get exaggerated. Then we have to give progesterones mid-cycle to control it. But otherwise, if it is only little while, say 1 day or 2 days, and otherwise in the all 4 5 days you're not getting it, then a painkiller, taking adequate rest, switching off light and going off to sleep, that is all that is going to help.
Right. Okay. So I think we have finally reached to the end of all the questions that we have for the day. Any
Okay.
parting thoughts from your end, doctor, for the session?
So I think I really enjoyed interacting with women. The questions were quite interesting, very relevant topics, and I hope I have been able to convey the message of a sustainable sanitary wear, because that is where small steps will lead us to a long way. And I would confess to you that it took me myself a little bit of understanding about sustainable period wear, sustainable sanitary wear, before I could switch to it. And it takes a little effort, but it's worth it. In long run, it's definitely worth it.
Very true, very true. Thank you so much, doctor, for taking out your precious time and sharing all this knowledge with our tribers. Thank you once
Thank you.
again.
Thank you, Shweta. Thank you, all the viewers.
Thank you.
It was
And
lovely
with
being
that,
here.
yes, and with that, it's a wrap on today's session. So stay tuned for more interesting sessions just on Parent Tribe by SuperBottoms. Thank you so much, everyone, for tuning in today.
Thank you. Bye bye.